Good morning. Welcome. Thank you for being here. We're at Mid-Michigan College this morning. My remarkable guests and I are, and virtually you are as well. So once again, thank you for being here and welcome. I'm Chris Pellerito with Mid-Michigan College. I'm far from the smartest person in the room this morning, considering our guests, and my remarkable colleague over here off camera, Beth, is happy to take your questions as we go through this morning. And my super talented, remarkable cameraman is not a valuable enough term, but Noah's behind the camera making all of this happen on the technical side. Mid-Michigan College, just so you're aware, when people ask, I'm tempted to say, well, it's in Middle Michigan, of course. But we have two campuses. We're on the Mount Pleasant campus right now, about 5 miles from our friends at CMU. And half an hour north of us, we have a campus outside of the town of Harrison, 500 wooded acres. It has its quaint rustic charm, and for many of you, it might be a better fit. But either way, that's not entirely why we're here today. Largely, as you know, we're here because of a roundtable conversation involving healthcare and the health professions. After a good amount of searching, I have what I believe to be 4 remarkable souls with me, and we're going to have some conversation. It sounds a little cliche when I say, oh boy, you're in for a treat, but you really are this time, knowing who we have here with us. So settle back, but certainly if you've got questions as we go, please send those our way. A few of you already did in advance, and you'll hear that. We'll get into that a little bit this morning. But first thing I'm going to do is I'm going to ask each of our guests, and guests is kind of I don't know, it just doesn't seem right. You're more than guests now. You're family. I'm going to ask each of our guests to briefly introduce themselves, and then we'll move forward from there. Barb, do you mind starting?
Okay, thank you, Chris. Welcome to MID. My name is Barb Wizazinski. I am the Dean of Health Sciences here at Mid-Michigan College. I'm also the Director of Nursing for our Mount Pleasant campus. Just briefly about myself, my background is in nursing. I've been a nurse for over 30 years with experience in the clinical setting, and then I have moved into academics about 15, 20 years ago. So at MID, we have numerous healthcare programs that you may be interested in, and I'll be glad to elaborate on those in just a bit. But again, welcome to MID, and I hope you enjoy your day.
I am Kennedy Aldrich. I go by Dr. Aldrich at work. I am a veterinarian. Specifically, I do small animal only, emergency medicine only, and I currently work out of Williamston, Michigan.
I am Jen Chandler-Connor, and I have worked in healthcare and higher education predominantly for about 32 years. I have degrees in nursing, journalism, business administration. I'm a lifelong learner, but I am currently in my dream job teaching at the Gresham Isabella Technical Education Center, where I teach health occupations, phlebotomy, and medical terminology.
Thanks for having us here today, Chris. I'm really excited about it. My name is Mike Fillenworth. I'm a physician assistant. I've been in healthcare for over 35 years. I started as a respiratory therapist and then went on to my bachelor's degree at Western Michigan. I did my PA degree at Central Michigan University, where I'm currently an assistant professor. I teach clinical reasoning, clinical problem solving. I stay current in community medicine as well. I run an occupation and urgent care in the Mount Pleasant area, and I've been part of the medical community in this area 25 years. Thanks.
Okay, excellent. Like I said, usually we have a heavy hitter, and okay, this person can bat fourth. They can bat cleanup because they're going to hit the home runs. But this time you'll see, I don't know, all 4 of them maybe. Okay, you kind of knew this question was coming, kind of, but it bears asking right out of the gate. Even though the majority of our audience, and there are about 200 of you in attendance right now, as far as my math goes, roughly, even though our audience has indicated, yes, I think I want to go down a health profession path. However, I see the real world, and I guess from my perspective, the question bears asking right away, why on earth, all things considered, you've got very bright folks who can do a lot, and why on earth would one choose healthcare? Why go that path when I could take that knowledge base and go make a lot of money in a lot of different, less challenging, less rigorous pathways? Do you mind starting, Barb?
Oh, absolutely. Thanks, Chris. Well, healthcare is ever changing. Healthcare is exciting. You have to be able to want to help people, and there's always sick people around. Healthcare is fantastic. We have technology in healthcare that is state of the art, that helps with diagnosing disease processes and also treatment of patients. But healthcare is an exciting field. It changes. The other thing about healthcare is there's all different areas to go into. Often people think healthcare is working in the hospital. That's not just healthcare. Healthcare is everywhere, from the community to hospital to physician offices, all across the spectrum, a lot of different areas. So if you get into one area and you have a change of mind, there's also other areas that you can go to. But lots of excitement in healthcare because there's always lots of sick people just waiting for someone to help them.
Many of these questions I'm just going to ask. Feel free, as we talked about, to jump in, or if you feel strongly and you want to add. If you don't, that's okay too. Anybody want to add to that answer?
You know, I think
Mike?
healthcare for me has been just a lifelong journey of education. And you can start at any level in healthcare and promote yourself to the next level. And I think that's one of the things that are really interesting about healthcare. It is your commitment to excellence. You have to have that skill. I think the next skill is empathy. If you're somebody that, you know, is a very empathetic person, willing to help, willing to stand in, I think the time that you have to interact with any particular family member, or you're really there to change their lives. And if you're ready to do that and you feel like that's in your personality type, then healthcare is for you.
I would completely agree with both of them. I mean, if you're just worried about getting a job, I will say, okay, so the U.S. Labor Bureau of Statistics will tell us that, you know, between now and the year 2030, we're looking at a 16% increase in job opportunities.
Yeah.
But that's not the reason. And to put that in perspective for our viewers.
Jen, that's one of my questions coming up.
Sorry.
Don't get going there yet.
Oh, sorry.
I'm
But
just kidding.
Across the board, you know, just to put that in perspective, that's double of all other occupations. So that's a very healthy opportunity in front of you. But really, that's not really, for me personally, why I went into healthcare or why I would maybe encourage it. I completely agree with everything that my team here says, that, you know, it's so rewarding personally. There's so much room for flexibility. If you are a person that would like to have a family, you can work weekends, you can work nights. All of us probably started in one area and kind of thought, oh, that's cool, I'm going to do that. I started out, I've always been drawn to geriatric people, individuals, as well as patients, and that led me down to working for 4 years in hospice. So I really, really appreciate the opportunities. And again, I think that it would be a very tough profession to look at if you weren't innately an empathetic person. You know, that is far exceeds any paycheck, which is a great paycheck, but it's just a beautiful thing, whether you're helping your patient as an animal or something.
Yeah.
You know, it's very, very rewarding.
Sure.
So.
Kennedy, you want to add anything to that? Yeah, absolutely. The two middle mics?
I think all the middle mics are not coming through.
So I'll just
I
take
have that switched. We're waiting for IT, but we can just pass the handheld.
Absolutely. My mic is clean, I swear.
Oh, okay.
Is this one okay?
Noah, is Kennedy's mic okay?
Sounds loud.
How about this one, Noah? The two on the left and right are working. Although these are on, they're not coming through there. So Okay.
Okay.
Perhaps.
It's okay. Yeah. Even though
Oh,
it
it's on the
sounds
other
loud
end.
enough
Okay.
to us. That's why we're in this room, because of the wiring is set up for Noah to feed
Okay.
this live. But I'm going to pass along my mic, and yeah, if you don't mind. Kennedy, go ahead.
Okay. I do very much agree with all the things that you guys said. I have like one very small thing to add, I guess. As much as this is a really like big and growing and lots of opportunity kind of area, profession, group of professions to go into, I would also add that there's a lot of improvements that need to be made, and I think a lot of that became very evident during the recent pandemic and a lot of things like that. And at least for me, that's part of why I do this, is because I want to make it better. Like, I want to be part of the change. I want to be part of, building, better systems and improving on the really good things that we already have.
Briefly give us an example. What needs to be changed?
I mean, for me particularly, we have a lot of problems with like our support staff. So while doctors generally, there's a lot of like supports in place for us and things like that. For us support staff, it's really challenging trying to establish like that's really loud now. There's kind of a hierarchy from like client services reps up at the front desk and my assistants and my technicians, and we're trying to. There's a huge movement right now to try to rebrand our technicians as nurses. And so that's something that I'm very invested in, is trying to make it more clear to my clients, so like the animal's owners, the role of a technician is not just technical work, right? They're the nurse. They're the one that's dealing with the patient every day, doing the nursing care and cleaning them and walking them and feeding them. And so we're trying to really build that role and protect that role, and kind of establish the importance of it, contrasted with kind of, as much as I, love my assistants and things like that, when you really need to put some protections in place for my licensed and registered veterinary nurses.
Excellent. Thank you. Okay, we'll continue moving forward. Thanks for your patience with us. I hope you didn't miss any really valuable responses that we've had thus far. Mike mentioned something, and it triggered a thought too. What I'm often intrigued with, like here at Mid-Michigan College, you mentioned laddering and building on a knowledge base. We have a short-term training in public health. It's like 10 weeks. That ladders into an associate's degree, also in the public health track, which ladders into a bachelor's degree over at CMU, which ladders into a graduate level degree. So it's just neat to see how smooth that can be.
I've trained at least 3 medical assistants that went on to nursing programs.
Excellent.
And, that's what I said. Where you start is maybe not where you're going to end up in healthcare.
Certainly.
But I think you go back to that commitment to excellence. When I came into this, you asked me to do this, I thought, I wonder who's going to be there. And I knew Barb was going to be there right away. And it's like, I'm thinking, it's like, we just get up and do these things. You know what I mean? It's like we don't think about it. And as soon as you ask me to do it, it's like, yes, that's great, because what we're trying to share is that sort of, we're at the end of our careers, and you're in the beginning of yours. So you should really look at not saying, well, I have to go to med school, or I have to do, maybe that's where you end up. That's not where you're going to start.
Mm-hmm.
And we often find that the students that start as your CNAs or your patient care technicians or your MAs, as they ladder up through the healthcare system, they often use that experience and make excellent providers, whether they end up in nursing or PA or in medicine somewhere. But that laddering is so valuable to them. And they bring with them those skills right along each step of that ladder, which we find very, very valuable.
Yeah.
Okay. Try your mic again, because it should be good.
Hello.
Yeah.
There you go.
Can you hear me? Yeah, this just kind of plays onto when you're in healthcare. We hear the term continuum of care all the time, and I might have a patient in the ER, and then he ends up in Mike's office, and on down the line, and we're all a piece of that continuum. And the same is true in education. Most of our audience is sitting in a classroom similar to where I teach at a tech center. And I can remember vividly, I was talking to Chris about this, sitting at 16, 17 years old thinking, I want to do that, but I don't know how to get there. Or I think I can get there. I've got the brains, I've got the work ethic, But boy, is that intimidating. I'm afraid. And fear of failure is a normal thing. But Mike said it very clearly, and so did you, that, you just take a step at a time. And so for those of you that are sitting in there today with us watching at the Tech Center, kudos to you, because you're going to come out with a certification that's going to give you that jump start. It's going to give you, I am a certified phlebotomy tech, or I'm going to be a certified pharmacy technician, and I'm going to have those direct patient care hours at that level. And that is, and this is a question to punch back to Mike here. Those are the things that when you're running a physician assistant program, you're looking at. Yes, everybody should have the grades, right? But what else are you bringing to the table?
Yeah, that's
and
the kind
so,
of people we put into the PA program.
correct.
I
You're
did
looking
admissions this year, and it was really shocking. It was like, okay, you were a CNA, and then you were an LPN, you're an RN. All of those kind of things build on where you're trying to head. But what we look at also is collaboration. I think the best example of collaboration for us would be what happened to the recent football player. And if you watched what happened, very clearly the recognition right away, the teamwork, and then the outcome. So, and look at all the people involved in that case. There's RNs, there's PAs, there's trauma surgeons, there's
People on the
nurses,
field
there's
that did
EMT, the athletic training. All of these things went just perfectly and it worked. So, and if that's what you want to be part of, then I would say if that's in you, you should really consider healthcare.
Very much. And whatever your jumping off point is, maybe it's high school, maybe you're at the end of your high school career and you're like, oh, I didn't do a tech program, or I'm a senior now. Oh my gosh, I'm a huge advocate of community college, specifically med, because I've worked alongside the people that are coming out of these programs, and I'm going to tell you, they're very well prepared. But the thing that's beautiful is, they offer degree pathways and non-degree pathways. Go take that CNA class. Call up an admissions rep here. Go take a phlebotomy class. Get your feet wet. See if you really like it, or do you just like the idea of it? And then ladder on in, and go all the way, if that's what you'd like to do. But don't be afraid to walk through that door. I'll say that.
Good point. Okay, you ready? It's not a curveball, but I want your frank answer. The Washington Post recently released a very comprehensive career satisfaction survey. And what was intriguing to me was, of all these careers, near the top was healthcare. Nothing else, amongst the ones in the top 10, none others were really similar to healthcare, but they all had similarities, the other 9. The other 19 had similarities. The one that had, in these 3 categories near the top, happiness, meaningful, and stress. All the others, the other 19, stress was not high at all. Why? Why is that? Why is that the one that's different? Why would you want to go down this path?
All right, I'll do it. So I am an emergency room doctor. So a vet. So I work in a very high stress environment all the time. So for me personally, of course it's stressful. Every pet I see is sick. I don't get to see your healthy puppy. But across the profession, and I know this is a thing in healthcare, but particularly in veterinary medicine, I know that stress is really important, and it's something that I think we need to be really honest about, because it's a big part of you choosing your career. And you're going to go into a profession where, especially for me, a lot is riding on everything I do, right? People really care deeply about their pets and, of course, their family members and themselves, right, when it comes to human medicine.
Kennedy, I think that's kind of the understatement of the year. A
Yeah.
lot is riding on what I do.
Every single moment, and I am not perfect. I am human, and things go wrong, right? And so that's where the stress is at. It's not just the potential for things to go wrong. It's the knowledge that some of the things I do are not going to work, and I'm going to fail. Sometimes I lose a patient. Sometimes things go down before they come back up at the end, and it's really it's having a resilience and accountability and being ready for that and able to take responsibility and educate people, patients, clients, kind of bringing them into that circle of, okay, this is a really serious situation, and I will be so honest, I am really worried about your patient. I am really worried about how this is going to go. But at the same time, on the other side of that situation, when you can come out, good or bad outcome, there is something so rewarding about being able to make that connection in the most emotional, stressful, worst moment of someone's day, right? When everything seems to be going wrong, even if we lose, right? Even if we fail, if we can do it together, it's so meaningful, and that is one of the most important things I do.
Makes a ton of sense.
Yeah.
However, I don't presume there's a textbook that you had in college that referenced what you're referencing right now.
Yeah, no.
So
No,
what
not at all.
what do high school juniors and seniors do to begin to prepare for what you're referencing right now?
Yeah. For me, I had to do it to learn it. I started working as a veterinary assistant in my very first year out of high school, as I went through college. And I just was an assistant. I was on the floor. I just had to see it. And yeah, there's no class, there's no book. In veterinary medicine, we have a really important organization called Not One More Vet that's been really helpful in kind of bringing together coping strategies and resources for people and trying to help make there be like a touch point for learning. But even with everything that they do, a lot of it is watching and learning. And, I spent 7 years on the floor as an assistant before I actually graduated. And so I've seen a lot of stress coping mechanisms that I liked, and I've taken bits and pieces, and I've also seen a lot that really didn't work, and people that ended up leaving the profession, and I've taken bits and pieces from them too and try to build on it.
On that note, did any of the four of you at any point, maybe that first year out of high school, at any point did you say, I don't know if this is for me?
1,000 times.
I was going to say, I think about 2 weekends ago, when I was working at the hospital.
I thought it would have been.
No, you have stress all the time. While working in academics, I stay current and work at a local hospital. And as a shift administrator there, I see stress all the time, from the traumas that come into the ER to the staff. But what you have to remember is that when we're there with patients, they're at a bad place in time usually, and they're not at their best behaviors. So when they're short and their behaviors are not always the best, we have to remember that. We have to remember that empathetic piece and step back and help them through those times. We're with them from birth to death, and there's times that it's very stressful, but you have to remember that you do make a difference to them. You do make a difference, even if you're just standing there listening or holding their hand or just being a listening ear for them. You do make a difference. And then you can walk off the floor and just go to your break room and just be very stressed out. But then put your happy face back on and get out there and see the rest of your patients, because unfortunately we live with stress every day in healthcare because of life and death issues that we face. But we learn different coping mechanisms, and then that will help you get through till the next weekend.
I think when you look at stress in healthcare, I think you look at accountability. So when you're held accountable, for certain medical situations, that brings you to a higher sort of cognitive level. And I think you have to recognize that you're at the leadership position, and as a leader, you're going to be stressed. And I can remember, really busy day, 40 patients a day, things are going terrible. But I had a patient that came in as a Native American, actually, interesting case. Came with abdominal pain. I looked at him, talked to him for a few minutes, and I noticed he had a pulsatile sort of mass in his abdomen. And I asked him about that, and I said, your stomach is pulsating. Is that new to you? And he goes, I hadn't noticed that. So, yeah, and I went, this mic working? Okay. So, anyways, this patient had pulsatile mass in his abdomen, and what was really interesting about that is he never noticed that. So I sent him right away to an emergency department. I said, hey, I'm really concerned this guy has abdominal aortic aneurysm or something related to that. And he went over to the emergency department. I called over to one of my teammates over there and said, hey, I'm sending you guys this patient to the ER, so, let me know what happens. And I got a call back from them and said, Mike, good call on that one. And he says, we're sending a helicopter right now. So this guy went from my office. I walked out, of my shift, and I was walking into the parking lot, and I see the helicopter flying away from our community hospital here, and it's like, so that's stressful, but it's also accountable, and that's kind of healthcare. So, right now the stresses I see are more related to the financial problem, insurances. We're not putting patients in the center anymore. We're putting insurance companies, and the administrators are trying to make money, and the nurses strike in New York. I mean, that was to me, I was like really excited that happened. It was a bad thing, but at the same time, finally this group says, hey, enough.
They're advocating.
They're advocating for their patients, and that's what it comes down to at the end of the day. How do we advocate for our patients?
I just want to speak really quickly to, again, specifically to our audience, which are predominantly the lovely, amazing human beings that I get to spend my days with. And I mean that so sincerely. I thank my kids literally. Oh, that is too. I actually thank my kids pretty much daily, because it's the best way to start out anybody's day is with a whole bunch of minds that are just so curious. But speaking specifically to the stress element, it is unavoidable. And you might be thinking, I'm 17. Your class stresses me out, Mrs. Chandler. How am I supposed to know when to call for a helicopter like Mike did, right? But let me just reassure you, it just goes back to that you're going to, first of all, I hope you're taking every opportunity and making every opportunity for yourself. At our level, that's job shadowing, that's getting those certificate programs, getting in and learning, observing, hey, that worked, and whoa, that was a little over the top. I'm not good with that. But you're going to build your strengths, and that's something we talk a lot about at this level. You can get the grades, you can be the smartest, you can do that, but you can't do this profession without knowing how to manage stress. You just can't. And so I'm going to tell you, start now, guys. Start now. Go immerse yourself. Go to an assisted living. Volunteer to call bingo. Go down to volunteer at HATS. Go, which is our Humane Animal Treatment Society. Go to Dallas to the Rescue. Go job shadow somebody. There are unlimited ways that you can immerse yourself in that environment because it's not Grey's Anatomy. It's not what you're falling in love with on the TV. It's the idea of it. Sure, we're all attracted to that. But it's the perfect time for our audience that are watching, oh my gosh, go for it. Go jump. And you might think, well, what can I do? I don't have my cert yet. There's plenty that you can do. Plenty. My gosh, you were doing it in high school. One way or another. Candy stripers in our day, right? So there are ways. So, but start building those soft skills now. Find out what kind of person you are. How do you handle stress? And you're not going to do it perfectly all the time. My kids see me with my hair on fire going 50 miles an hour every morning, right? So, but learn what works and learn what doesn't. And, so I can't emphasize it enough. Don't wait. Just start working on who you are now. I preach team to my kids every morning. I want the person, and this is back to Mike again, I want the person that is so well-rounded. Yes, they have the clinical knowledge, but can they reason their way through that? Do they show appropriate responses? Are they compassionate with our patients and their family members, right? You're treating the whole family. Right? And let me tell you, that is the most rewarding thing. I don't even know when we get paid because I don't look, right? I feel like I get paid every time somebody says, thank you so much for taking time to stop and explain that to me.
Good point.
And with your knowledge base, increasing of your knowledge base and your confidence, you learn to deal with that stress in an appropriate manner, so.
That makes sense. And it's interesting because I was just thinking, I was listening to your answer, but I was just thinking, and I think you and I have talked about this in the past. almost any profession, no offense to any other profession, but almost any profession, one can go online and YouTube. I can do that. I can change my carburetor. No offense. We did skilled trades last month. I don't want to change carburetors. But not healthcare.
Right.
You need to know it. And I presume that makes it the stress level a little more tolerable because you know it.
Right.
Sure. Okay. Batman had his utility belt, but I'm going to make this a little broad. It's a backpack. You may put one thing in the high school senior's backpack that they will carry with them for the rest of their lives. And I'm talking, wait a minute, it might be like, for example, a credo to live by, or principles, or strong conviction, or adaptability, problem solving, creativity. What would you put in their backpack?
I would put critical thinking. I think that critical thinking is so important. And you're going to say, critical thinking, what's that? I don't know what it is. I don't know how to do critical thinking. As you're in our healthcare profession programs, you will develop that skill. But that critical thinking is so important because as a healthcare professional, you have to be able to anticipate what is going to happen to your patients. If you're not anticipating what's going to happen to them, you're going to find yourself in a situation that you're not sure how you're going to handle. But if you can use those critical thinking, problem-solving skills to get to the end product, that is going to be so beneficial to you. So developing good, solid critical thinking skills to me is that tool that they need, Chris.
I'd wager there are half a dozen Career Center Health Oc teachers right now cheering, saying, yes, that's what I tell them
Critical
too.
thinking. Yep.
Yeah.
Who else?
Okay. Humility. And a good knowledge of your limits. I could talk about it for hours, but basically, like, we're all pretty good up to a point. And then there comes a point where it's time to hand it off to someone else. Whether it be, I can't draw blood on this cat because it's too dehydrated, or it just hates me, or like, I do some really scary big surgeries a lot of the time, and sometimes, like 2 days ago, Michigan State called me and tried to send me a surgery, and I was like, like, no, I will not do that. And that is one of the things I most value in myself, is being able to know when to say no, for both the safety of myself and my patients and their owners and also in my staff, like my support staff, my assistants, the person who tries once, fails, stops, and says, hey, Dr. Aldrich, can you come place this IV catheter? Like, that gets 10,000 bonus points from me if somebody knows when it's beyond their skill set.
Makes perfect sense. Is your mic good? I think. No? Here.
Sure. All the teachers out there will love this, but Barb took my answer. I'm just going to say, because my kids are going, oh, she's going to say it. I just so agree with you so much. You can call it critical thinking. You teach whole classes. You teach people that skill. And again, it does grow. But what I refer to it with my kids, and I say this to them all the time, I'm super happy you're a 4-point student. I'm glad you memorized those 350 medical terms. That's fantastic. But guess what? If I'm your patient, okay, I don't really want the person who memorized 350 medical terms to care for me. I want the person who has the critical thinking skills. And what I call them are assessment skills. If you can have a patient that comes in and they're cyanotic and they're clutching their chest and they're diaphoretic and all these things, can you piece that together? Because those are symptoms that could apply to 20 different kinds of things. So I'm wanting my students to understand the importance, and what I would put in your backpack is the ability to be humble, to act as a teammate, as to collaborate for those critical skills, which you'll build. Barb's just nailed it. that I think critical thinking, aka assessment skills, the ability to piece it together. And really, because it's a huge responsibility. It is. And I want that person that's going to think and think through and use their knowledge, not a memorizer. I want a thinker. So assessment skills, that's my answer.
Okay. You threw a couple of words in there that, I was going to ask Beth, like, what does that mean? Like, psionic and
Blue and sweating.
okay. Okay, now I know. What else?
In your backpack, I would say perseverance. Perseverance means you never give up. And, that's just it. You're going to fail, and you're going to fail, but you'll have mentors there to help you with your failure. So that's kind of the thing we do. We stress. I do teach clinical reasoning. It's interesting. The process of trying to get somebody to clinical reason is really, it takes a long sort of process for they start to get those skills. But perseverance is probably one of those things. You failing and learning from your failures, huge thing to have in your backpack. It goes along with humility, And I'd say the last one is professionalism. Once you finally commit to being a professional, you're a professional and you can't be late. If you choose to be a student in this nursing program, you shouldn't be late to class. You should not be late to my class. So we talk about that professionalism, and we measure it and grade it. You're held to a higher standard, and that's the kind of stuff we try to teach and embed in the programs that we teach in. And the students that we have, if I take a shadow, somebody shadows me as a high school student, or I take somebody I'm mentoring as, in another program, we just expect them to be there on time. We expect them to be ready to go. Like, mature up here. It's time to grow, So you're in high school now. You're junior. We understand where you're at as a junior and a senior. But when you start developing that sort of decision making, just because you decide to be a nurse or a PA, that doesn't quite get you to that sort of level. So some failure, lots of perseverance. You may not get into the PA program you want to. You may fail the first time in nursing to try to get into that program. You don't stop there. So,
good point.
Yeah.
Just add to this here, because it kind of goes along with it a little bit. There are most assuredly students watching right now who are not rocket scientists. I often used to joke with Beth a little bit, like when I meet a student who says to me, I want to get into MIDS nursing program, I used to sort of like, ask them, do you like science? And if they say no, or I think, I used to kind of sort of bite my tongue. Now it's like, well, are you sure? But then as you get into conversation, you find, no, they're not all, everybody interested in healthcare is not brilliant. What do you tell those students? I mean, it goes along with the perseverance thing.
I think what you say is, I was in surgery, and I was doing my surgery rotation, and the surgeon asked me, who do I think the most important person in the room is right now? And so you have the anesthesiologist, the surgeon, the surgery tech, the rotating RN. And I said, well, I probably, maybe the anesthesiologist. And he goes, no, it's the person that cleaned the room. So the housekeeper. So it was the housekeeper, and that might be where you start. Maybe you start as a housekeeper, a houseman, or you start as, that may be where your starting point. Actually, that's where my starting point was. So out of high school, I was a housekeeper, and then I met a respiratory therapist, and then I went to respiratory therapy school, and then I did my bachelor's at Western, and then I went to PA school, and it's just, you don't quit,
I have to speak to that. I've shared the, I'm sorry. And then you can.
She can't help herself.
I know, I'm so sorry. And all my coworkers are going, oh my gosh, here she goes again. But I didn't even have, when I was, and both Beth and Chris know this, when I was 17, at the age that I teach now, honestly, I knew I wanted to go into healthcare. In no way, shape, or form did I think that I was good enough. I didn't understand. I didn't see myself in that role. I was afraid of the responsibility. I was afraid of the hard work. I was afraid of failure. I was afraid of the grades. I was afraid I just wasn't good enough. You are good enough. And this is not a cliche statement. There is a place for everyone. I ended up chickening out, and my kids know this story too. I went a different route. Which actually placed me in a hospital setting. I did a lot of marketing and healthcare in healthcare arenas all over the state of Michigan. Loved it because I still was hung up on myself. I was my own worst enemy. I thought, well, if I'm not good enough to do what they do, I can be around it. you are good enough. You are your biggest champion. You should be. I ended up easing my way into it and didn't go back to nursing school until I was, oh my gosh, 15 years after my undergraduate. I was a very non-traditional student at a different point, and I agree. There is a place for everyone. There's healthcare is unfortunately a business, and but we've got certificate programs. There's so many opportunities for you to get your feet wet and figure it out. And again, the people who are with us today are the lucky ones. They found that tech class. They're in there getting 2.5 hours a day. They're in there job shadowing. They're building relationships. They're coming over to Mid. They're working, they're going through those programs with CMU. They're doing clinical experiences. So they get that. Make the most of it. And don't be afraid, really. Don't. But back to you. If we don't have a sterile surgery room, it doesn't matter what anybody else does.
Exactly right.
Really,
So
really good point.
let me tell you, it really, really matters. You probably have a few stories too.
I guess I think what's really important about this particular question in veterinary medicine is and especially I'm sure for those watching, there's so much emphasis on getting into vet school. And it's probably all you ever hear about is how do I get into vet school? How do I get into vet school? Like, how do I build my application? That was like my entire life from, I think I decided to be a vet in like middle school-ish. And that was my whole life until I got into vet school was how do I get into vet school? Like I remember even like my extracurriculars was like, is this going to look good on a vet school application? And that application, and this is goes back to what we were talking about at the very beginning of things we need to improve in the profession, focuses so much on grades, right? And you hear, like, if I'm going to get into vet school, I have to have perfect grades and I have to be the smart one. And unfortunately, that has been true for a really long time, and I think it's something we need to change. I mean, I was the smart one. Like, I'll just say it. I mean, I 4-pointed high school in the majority of my undergrad with the exception of physics, which did not go well. But, like, so, I mean, for me, yeah, okay, I had the grades, whatever, fine. In the day-to-day of the actual job, though, like, I don't have everything memorized. It's more important that I know who to ask, where to find information, how do you look through a textbook. Like, I have been in surgery with a textbook open on a stand next to me, and, like, where do you find that? How do you do this? Like, who do I ask, who do I go to, is more important than how many medical terminology things we remember, and so it's definitely not all about like how book smart or standardized test smart you are at all, not at all.
I agree 100% with that. Just what I want to say to you is that if you are not a 4.0 student, please do not be discouraged. You can get into our health science programs. You will be successful. Often what I see is that our 4.0 students, while they are fantastic in the classroom, understanding that bookwork, they memorize a pick list. And then they get into the clinical setting and their patient is not a pick list. And then they struggle with figuring out how they vary from that. But if I have students that are not 4.0, they're 3.0, wonderful students, because they can think about, okay, I understand what's going on in the book, but yet they can take that to the clinical setting and apply that to what's going on with their patients. They can also then be flexible. Often your students that are 4.0, they lack that flexibility because they think everything has to be exactly like it is in the book. And I am telling you, healthcare is not exactly like it is in the book. So please, if you are not a 4.0 student, please don't be discouraged. Do not be discouraged. Our best healthcare professionals are not the 4.0 students. Don't tell your teachers I said that, but we have fantastic people in healthcare that came in that were not 4.0 students, and you will learn those skills to be successful. So please don't be discouraged.
Okay, Barb, I want you to keep rolling, so bear with me here. According to the AMA, 10 years from now, we'll be over 100,000 doctors short, and that's like the safe estimate. And it's across the board with healthcare professionals. I'm sure each of you know that. I'm sure our audience has heard that. It seems that building and sustaining the healthcare workforce of the future might be, and this is my estimation, maybe that's the single biggest complication of all of it. Why is that so? But before you answer the question, also, because what I see in what Beth and I do on a daily basis are students that either they just don't know what's on the menu ahead of them, or they're paralyzed by choice because there's just too many choices out there. For example, a student can come to Mid-Michigan College and be part of some truly remarkable healthcare pathways, medical assistant, physical therapist assistant, radiography, other medical imaging studies, an astounding nursing program that kicks the butt of any other nursing program in the state. I'm sorry, I couldn't help it. Why? Why is there still a healthcare shortage? Because it's been at a point of emphasis literally for 10 years already. Why?
Good question. I wish we knew that answer. But yeah, exactly. That's the million-dollar question. I think one of the reasons that there's such a shortage in healthcare is that there's so many things that people can go into, and they're not exploring all of the different healthcare arenas there are, because healthcare isn't just nursing. We have all different areas to go into. Also look at, there are less students coming into programs. The population just in general is not there anymore. I think that they're understanding that healthcare isn't that glamorous thing that they see on TV, that you actually get your hands dirty in healthcare. If someone says, you're going to take care of someone that is at the end of their life, they're like, well, I don't want to be at that sad point with them, but, it's just different things happening in society right now. I also think that, unfortunately, COVID affected healthcare and people wanting to come into healthcare. I think that frightened some people away, but I'll tell you that, we did great through the through the COVID pandemic, and keeping our healthcare workers safe. I felt completely safe going to the hospital every weekend. But yeah, that's a good question, Chris, and we're still trying to figure that. We still have robust admissions in our healthcare programs. So we're just looking at drawing more students that are really interested in the profession as a profession, not as a paycheck, is what's really important.
Okay.
Go
ahead.
Let me expand on that. The program that I represented in Central Michigan, we just expanded our seats up to 60 from 40. So that's the first thing. We serve rural underserved areas, but also suburban underserved areas as well. And those are the areas typically that you're not going to see as many healthcare providers. They don't necessarily want to practice in, rural areas up in the UP, Upper Peninsula, small hospitals. But the other thing is the small hospitals are suffering so much financially. And that is just a big reason why we can't get the jobs that are available in those areas, because hospital systems are not doing well. So now we're in a big process of hospitals buying other hospital systems out, and we'll see if that shakes out and that actually benefits the sort of need that we all see. So I don't know, I don't know if people are not going into healthcare as much, but it's also the systems that hire and actually support those positions. So some of the confusing thing in my profession is they think we're physicians. I think a PA is a doctor, physician associate's a doctor. It isn't a doctor. We're sort of, and I don't even really like the terms mid-level. I really don't like that either. Advanced practice provider, that kind of stuff. We're healthcare providers. You know what I mean? And all the licensure that goes with it and all that kind of stuff. Whether you're a nurse practitioner or you're a PA, we're just providers. And so we really are committed to those areas. But it also becomes, it's almost more difficult to work in an area when the pool of employment is low. And Petoskey, Kalkaska, Cadillac, you start looking at these healthcare systems, and they have a payer mix that is so low that the payer mix being who actually pays into the hospital. These places are really suffering right now. So I think that's going to affect all of us.
Okay, we're regretfully running down to the end here. This has been magnificent. I'd like you to tie in 2 parts, and I'll ask each of you to add whatever you choose to. This question is actually one of my favorite questions to ask. I ask every roundtable, regardless of the topic of conversation, but it's a little more pertinent here, and here's why. Steve Jobs once said, if you want to make everybody happy, don't be a leader, go sell ice cream. It was clear, at least to me, during the pandemic, that there are some bright people in the world, and I'm optimistic because of that. But my concern is if we don't listen to these bright people, there's a problem. Will the world ever really listen to healthcare professionals? Can they lead the way as they probably should? And whatever final thoughts you want to share, please share that as well.
It's a tough question.
I've
Chris.
got
That
them
was
like
a good one. You blanked us on that. I mean, you're really talking about leadership and involved with politics and involved with, concerns related. That's for us as like providers, we feel like the patient is the most important thing. And I think if you give good health care, everything else is going to fall into place. And I kind of always gone by that. You give as much as you can to your patient in your population, and everything else should fall out. I guess that's the best way to look at that. So,
I agree.
so.
Do I need this?
Please.
Again, Mike took my answer. I'm kidding. No, leadership looks, there's no rule book, like you said, that no, this is how you're supposed to lead, and this is the only way you're supposed to lead, right? And so just be really cognizant of what you can do within your parameters at whatever stage you're at. You can be a leader in my classroom. If you just went and ran for HOSA president of our health club, and maybe you didn't get it, the person sitting next to you did. That's okay. Guess what? You're going to also be a leader. You're just going to do it in a different way. You're going to come at it from you're going to lead by example. You're going to look at the other people who didn't even have the guts to go ahead and, throw their hat in the ring. Guess what? I'm going to bring you along with it. And which kind of segues into my answer. I agree with Mike. I think we're up against in healthcare a big machine that's a big thing to move, specifically in this country, and how we address healthcare. My kids, I teach them the difference between a PPO and an HMO, and we go very in depth about insurance here pretty soon. They need to know. And so I think that you have to, I can't recommend this enough, polish those soft skills and practice your leadership, practice your listening skills, practice your communication skills, those kinds of things. Be a problem solver, critical thinker. You're going to learn the skill set. Like Barb said, you're going to learn it because you have to. But apply those things within the capacity that you have and gradually move that along, because I promise you, your team and the people that are maybe in the hierarchy above you are going to notice that. You're going to make a difference, and you can make a difference at whatever level. I don't care if you want to put the label of leadership on there or not. It's not the person who screams the loudest in the room. Very often it's the person who doesn't say a lot, who we think, what is that person thinking and what can I learn from them? So leadership looks different, and you don't have to wait to start on that. So find your brand and go for it. Immerse yourself. Be the leader in your classroom right now. Be the leader on your team. Those are the people that are going to make the changes. So I don't know about moving the big beast of insurance in this country. That's a hot topic for me. But I think it all begins with education, quite frankly. So.
All right, there's 1,000 different directions I could go.
Well, Kennedy, regretfully, this is not a 2-hour presentation.
I know. It's can be an uphill battle, and I think a lot of this just comes back to communication, especially the way that things are right now. When you look at like the internet and social media and stuff like that, maybe I could reach more people if I had a TikTok and like a charismatic makeup routine or something, but like I don't, right? So a lot of it is going to be, Dr. Google is really powerful. Right. Dr. Google will reach more people than I ever will, but Dr. Google does not have empathy or the ability to connect with people, and that's what's going to bring us forward, right? Whether somebody out there is probably connecting with people through their charismatic makeup routine, but for me, it's like trying to get people to understand why I care, day to day, and then making them care. And, people, owners of pets, don't really care if I can list every vaccine preventable disease from memory. Like, that doesn't really matter, right? But if I can help to communicate, what is the thing here, like in your dog who has this disease or this problem right now, like, why does this matter to me? Why does it matter to you? And maybe they'll go home and tell their sister who just got a new puppy about all the stuff I told them. And it's just one little step. And I said this a whole lot it is the beginning of the year, but the beginning of the year, like, I'm not really a new year, new me person. I'm more like a every day, can I do just a little bit better? Can I reach just one more person? Can we do these things a little bit better? Like, if I go to a conference and learn some sexy new surgical technique and implement it, like, okay, fine, maybe that's fine. But I think it's more important to say, I learned one thing yesterday from this patient or this client, and maybe I can teach that one thing to one of my techs, and maybe they'll mention it to one other client, and maybe they'll bring it home to one other person. And that's how we change the world, is like a little bit at a time.
Yep. Super good point.
Exactly. And I also think that in healthcare, you need to base your decisions on science. Look at science. Look at what is the truth out there. Because like Kennedy said, you can Google anything. And you have to be careful with that. So leadership is based upon science and what is actually true and what is not so much true out there. And then the empathetic piece. But look at what your patient outcomes are. Your patient outcomes are what is so important. If you're a healthcare provider and your patient outcomes are not well, then you're not going to be looked at as a leader in healthcare. If your patient outcomes are fantastic, then you will be looked at as a leader in healthcare. So look at your patient outcomes, look at your empathy, but also base your decisions on science. What is right for those patients?
Wow. I told you they would each hit it out of the park. Who bats cleanup in this group? Okay. This has been a wonderful, very quick hour, if that makes some sense. So I'll leave you with this. I teach sometimes here at Mid, and as a matter of fact, yesterday morning we just had some conversation about the power of gratitude. It can be two things. Asking questions and being grateful can be very powerful. So I want to first and foremost thank each of you. I knew this would be valuable. I had high expectations, but you've exceeded them. And I used to, when I met someone in law enforcement or the armed forces or heading in that direction, I still do, I thank them. But now I find myself, when I find a young person heading into health occupations, I feel compelled to thank them as well, because clearly it's a big commitment. So thank you for considering making that big commitment. Thank you for being part of this with Mid-Michigan College. Beth, thanks for your efforts over there. Noah, you rock. I'll leave you with this. It's one of my favorites. As a matter of fact, it's at the bottom of my email. Real heroes don't always wear a cape. They often wear a mask. And what is that implying? They're probably healthcare professionals. So once more, thanks for being a part of this. Feel free to send us a note here at Mid if you want any follow-up of any sort whatsoever, because I know with certainty Jen's got a surplus of follow-up, so we'll leave it at that. Thank you again for being part of this. Thank you.
Thank you for having us.
Yeah. Thanks, Chris.
My pleasure.
I appreciate it.
I'd come back and do it again next week.